Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great exercise for your spondylolisthesis pain that deals with increasing the motion at your sacroiliac joints. Hope you enjoy. So most people with spondylolisthesis have a tendency to have their pain aggravated with leaning backwards. If they're walking downhill, there's an extension or an increased arch of the lower back component, reaching backwards, laying on their stomach, because as that arch increases in the lower back, as the tailbone comes up and the pubic bone comes down, or as the chest leans backwards, the back portion of the spine becomes compressed. And remember, with spondylolisthesis, that vertebra in an anterolisthesis situation has moved forward, and the posterior or back aspects of the disc fibers, the joint capsule, the ligaments on the back become compressed. The synovial lining inside the joints can become irritated and pinched, and many times that causes spondylolisthesis pain. So there's a lot of people out there teaching abdominal exercises to try to increase the strength of the abs, which will bring the ribs down and the pubic bone up to decrease that arch in the back. But unfortunately, that's not nearly enough, because many people with very strong abs still have spondylolisthesis pain, because what they're not evaluating is what's going on the back of the body. And today what we're going to talk about is sacroiliac joint function and how that can help with spondylolisthesis. Your sacroiliac joints are the connections between your pelvic or iliac bones on both sides, right and left, where they attach to the triangular sacrum at the base of your spine. And you can actually feel an aspect of that sacroiliac region by going to your lower back and coming down until you feel two hard bony knobs. They're about 2 to 3 inches out from the side of the midline of your spine. Those bony knobs are called your PSISs, posterior superior iliac spines. They're the knob of the pelvic bone on each side. And normally those knobs should be able to move downwards. As you tilt your tail under and pubic bone up, a pelvic or a posterior pelvic tilt, you should feel those knobs move down away from your thumbs. And they should move down symmetrically from right to left. Unfortunately, in many people with spondylolisthesis, these joints become tight and stiff, and they fail to have that motion of being able to move. And as a result of that, what happens is the connection from these PSIS bones or iliac bones, known as your erector spinae muscles, the lumbar or lower aspects of these, specifically the iliocostalis and the longissimus, these muscles are key to spondylolisthesis because part of their fibers attach in such a way to the vertebra that they can exert a backwards pressure or a retroversion, meaning they can help stabilize and create a pressure that holds the vertebra back so it doesn't slip forward anymore. No amount of abdominal training is going to help that. These are back muscles that need to function correctly, and many times when the joint is stiff at the sacroiliac, it won't allow those muscles to exert their proper mechanical pressure, and you can have more spondylolisthesis pain than you should. So a simple exercise to mobilize these joints are to keep your thumbs on those points we talked about, and if as you tuck your tailbone under, you feel one side stiffer, meaning it's not moving downwards away from your thumb towards the floor as much as the other, is to place that leg up on a stair step or an exercise bench and simply tilt your tailbone under and hold it for 2 to 5 seconds and then release. Again, tail under, 2 to 5 seconds. By moving the leg up, I help to take the whole ilium or pelvic bone and rotate it more in the correct direction. And after 2 to 5 seconds in each direction, I can go back and forth cycling these repetitions for 5 to 12 times. Again, holding each one 2 to 5. And recheck then, once I put the leg down, my tail under, I'll notice there's more freedom usually because I've just contracted the opposite muscles on the other side of the body in a way to create that sacroiliac joint's motion coming in the right way, which is a posterior pelvic tilt or flexion of the sacroiliac joint. That alleviates the mechanical stress on the longissimus and the iliocostalis muscles, allowing that spondylolisthesis to have a greater chance of being able to pull back. Muscle function is directly related to its length. There are things called length-tension relationships that become altered when we have postural problems and tight joints. By performing exercises like this, you help to establish normal length-tension relationships, normal mechanical forces on your spondylolisthesis, and help to avoid your spondylolisthesis pain. Hey, if you like this kind of video and the information we're sharing, give me a thumbs up below. Let's share it with others. If you'd like to subscribe to our channel, whether you're a new visitor to the Pain Free and Fit channel or you've been around for a while, subscribe. We got lots of great exercise for spondylolisthesis and other musculoskeletal pains to get you back into shape. If you have questions or comments, please leave them concerning spondylo or other things having to do with fitness, pain, and injury. I'll do my best to get back to you, maybe even make a video answering your question. Remember, we have a great new program coming out for spondylolisthesis, the Fast Track Exercise Program. It's coming out this July 2018. That highlights all of your body analysis you need to determine where your unique posture and mechanical issues are, how to target mobilization, pain relief, stretching, and strengthening conditioning exercises to really get your body in the best shape possible so you too can live the pain-free and fit lifestyle.